Okay, good afternoon, Dr. Jason Amstutz with Link Sports Council. I'm presenting a little bit of information on osteoarticular pumping for the upcoming courses. We're redoing pumping 1, 2, and 3 over the next 3.5 months, and then we're going to go into year 2 and 3 work starting in December 2022. So a question that I get all the time from patients and from other practitioners and students and athletes is, how is this different than other modalities and other treatments? And there's just a little bit of background that I have to explain first. One of them is a word, tensegrity, which hopefully all of you out there have heard before. And there's two major components to tensegrity. You have a compression component and you have a tension component. I'll talk briefly about tension. Tension is the one where I think most of the focus is, especially in this country. Tension is a combination of ligaments, and then I don't like to say muscle because complexly the muscle is a tendon to aponeurosis to tendon. And then if I want to be more specific, I could put periosteum on either end of that. I'll leave it and truncate it at that. This is where the bulk of the focus is. But it's this compression element which isn't as clear as it may seem. The compression component mainly is fluid. In order to have an anti-compressive nature, it's not just the intervertebral disc, it's not the meniscus in the knee, although it partly is, and the labrum and other things that are notoriously fibrocartilage, load-bearing, etc. It's more about the quality and the quantity and the presence of the fluid. And the fluid is the anti-compression, which really drives the majority of this tensegrity puzzle. So the pumping directly influences the fluid and the fluidity of the joint first. We're talking about osteoarticular, and that's a fancy word for joint. That is how we manipulate the body, mainly through the fluidic nature, not just of the lymph or the venous system or the arterial system, but the water that's in the extracellular matrix, the synovial fluid at the joint, that's a good place to start, etc., etc. So the osteoarticular pumping, although we're talking about the fluids, it's a real big part of the longevity of the treatment. How long does the treatment last? And that really is based on, have you changed the fluidic component? If there is a fluidic component, part of the problem. And if you have, then you have a more permanent change. And then if you give them the right exercises, not specifically for strengthening or stretching, but more to just move the joint complexly, whether it's in a pool or out of a pool, then you have the patient or athlete's ability to continue this fluidic change at their joint or somewhere else to continue the process and make the treatment last longer. Thank you.